Hi, my name is Lynn Amiter. I'm Director of Food and Nutrition Services for the 4 Emory hospitals. And what Magnet means to me is about collaboration and about working together, particularly with nursing and food and nutrition services, working together to improve the quality of care as well as the quality of service to provide for a real seamless delivery of care and service. A more recent example of a Magnet moment is the involvement of our staff in the unit practice councils, the UPCs, at the unit level. And a UPC is an interdisciplinary group that gets together on the patient unit to talk about things that they can do to improve the care and the service to the patients on that unit. Some of our hostess staff have recently started attending the UPC meetings on the units where they pass trays and where they interact with the patients. And one of our hostesses has been very excited, having just attended her first meeting very recently, because not only did she learn a lot of things about the unit as part of participating in the council, a lot of things about plans to improve care on the unit that will make her be able to do a better job on the unit too, because she's aware of things, but she also was able to discuss with the group and make a recommendation that the tray tables, some people call them the over-the-bed tables, but the tray tables be cleared prior to when she arrives on the unit to pass the patient trays. And it was really neat because she was able to express in her own words as the person passing trays what happens when the tray table isn't cleared off, how that impacts the temperature of the food to the patient, how that can maybe impact the quality of food for the patient, how it can even lead to frustration for the patient because maybe the tray has to be placed somewhere else in the room where they can't reach it. And the group discussed it, as I understand, and they're actually working on plans or talking about what they can do to help out with this situation. So by working together, we'll all be providing better care to the patients on that unit.
Hi, my name is Wanda Turner, and I'm a new member of the UPC program on 61 South. To me, Magnet means partnering with the nurses for the patients to have better care where they can get their food on time and won't have any issues with their service. We was having some issues with the patient tray tables, with the tables being cleaned off when we get to the room to actually serve the trays. So in the UPC meeting that we had, I brought up about working with the nurses where we can get have the tables cleaned off when we arrive, but that way the patient can get their food nice and hot and not have to wait for me to clean the table off and then give them the tray. So the nurse is going to get with the techs so we can work out the problem, and that way the patient food will be hot when they get their trays.
Magnet means me.
Magnet means me.